You ever feel like your eyes are just working against you? You know, one minute things are crystal clear, and the next, you're blinking through this frustrating blurry haze. Well, today, we're going to dive into the really surprising link between common medications, dry eye, and that exact problem. So let's get right into it. So just think about your day for a second. Does your vision ever start to get a little fuzzy, maybe a bit smeared, especially by late afternoon? You could be trying to read something, or maybe you're driving, and things just aren't as sharp as they were that morning. If that sounds at all familiar, I want you to hear this loud and clear. You're not imagining it, and nope, you're not just getting old either. This is a very real and often a very solvable issue. We're going to break down exactly what's going on and, more importantly, what you can actually do about it. So let's approach this like we're detectives. We'll call it the blurry vision mystery. Right now, it might feel pretty confusing, but I promise by the end of this explainer, you're going to have all the clues you need to start solving it for yourself. Our prime suspect is a condition called medication-related dry eye. Now, this is super common, especially after age 60. It's where the daily prescriptions we need, and often take together, can start to stack up, causing this on-again, off-again blurriness and discomfort. And we're not just talking about gritty feeling eyes. This can genuinely mess with your vision. And the number one clue? It's something called fluctuating blur. The best way to think about it is like a moody windshield. One moment, everything's perfectly clear. The next, it's hazy. And then maybe it gets better for a second right after you blink. That changing, unstable blur, that's a massive clue. Okay, so how do we start gathering these clues? Well, first, we have to learn how to decode what our own eyes are trying to tell us. This is the part where you become the lead detective in your own case. You know, the timing of the blur alone can tell your doctor a whole lot. Is it worse when you wake up, or does it build up through the day? A morning heavy blur, that could point to things like overnight dryness, or maybe even an air leak from a CPAP machine. But if it's an evening heavy blur, that might reflect a full day of screen time, dry indoor heat, or even the moment when your medications are peaking in your system. So here are the first clues you need to start tracking. It's a really simple checklist. First, does the blur get better, even for a second, right after you blink? Second, what's that time of day pattern we just talked about? Is it morning, noon, or night? And third, what are your trigger settings? You know, does it get worse in a windy car, in front of a computer screen, or in a room where the heat is blasting? Just jotting this stuff down is your first big step. All right, now we get to the heart of the investigation. The usual medication suspects. And I want to be super clear here. We're calling them suspects to be reviewed with your doctor, not villains to be blamed. These are almost always essential medications. It's their combined effect that we need to understand. So just how many common medication groups are we talking about? Well, we're going to walk through nine major categories that are very frequently connected to dry eye symptoms. Kicking things off, we've got antihistamines and decongestants. Makes sense, right? They're literally designed to dry things up, and that effect isn't just limited to your nose. Next, certain antidepressants can reduce the signals that tell your eyes to make tears, and some, but not all, types of blood pressure meds can also contribute to that dryness. Moving on with our lineup, there are diuretics, which most of us know as water pills. Their job is to reduce fluid in the body, and that can include the fluid available for your tears. Hormone therapies can sometimes affect the little oil glands in your eyelids that are so crucial for a stable tear film. And some strong acne meds, like retinoids, are pretty famous for their drying side effects. And to round out our list, some medications for Parkinson's disease can actually reduce how often a person blinks. Then you've got certain sleep and anxiety meds that can have drying side effects. And get this, even some chronic use eye drops, especially the ones with preservatives, can end up irritating the eye's surface over time. But here's the real takeaway. The effect of all these can really add up. One person really put it perfectly. They said, "No single med wrecked me. The pileup did." And that right there is the core idea. It's usually not about finding one single bad drug. It's about understanding how the total medication load might be putting stress on your eyes. Okay, so we've identified the suspects. Now it's time to get practical with your detective method. This is the tool that's going to help you turn a vague complaint like, "my eyes are blurry," into a really focused, productive conversation with your doctor. And here it is, the 14-day symptom log. It seems so simple, but believe me, it is powerful. Step 1, you list everything. And I mean everything: prescriptions, vitamins, supplements, over-the-counter stuff. Step 2, you write down the time you take each one. Step 3, throughout the day, you track your symptoms, like blur or burning, on a simple 0 to 10 scale.
And step 4, this is a great one. Note your confidence driving at night, also on a 0 to 10 scale. This one page of data is absolute gold for your doctor's appointment.
So, with your logbook full of clues, it's time for the Safe Action Plan. This is all about what you do next, focusing on proactive steps that are, most importantly, safe. Now, before we get to the to-do list, let's cover the not to-do list. This part is critical. First, and this is the most important, never stop essential medications on your own. Second, try not to get into a daily habit with those get the red out drops. Also, don't just assume it's the glasses problem, and please, don't wait months and months to ask for a medication review. Time is of the essence. So here is your positive 3-step pathway to getting some clarity. It's really simple. 1. Detect. Use that log to track your symptoms for just 14 days. 2. De-risk. Avoid those common mistakes we just talked about. And 3. Coordinate. Take your log to both your primary care provider and your eye doctor so they can look at the whole picture together. And to make that conversation just a little bit easier, here is a simple, really effective script you can use. You can walk right into your doctor's office and say, I'm asking for a safety review of my total regimen because my blur pattern has changed. It's clear, it's calm, and it tells them exactly what you're trying to achieve. Because at the end of the day, that's the whole goal here, right? It's about finding that sweet spot, achieving safer, more comfortable vision without sacrificing control of the chronic health conditions that those medications are treating. It's all about a smart, coordinated plan. So I'm going to leave you with this final question. What is the one concrete thing you can do in the next 15 minutes to get started? Seriously, don't wait. You could grab a piece of paper and start that medication list right now. That one small action is the first step toward getting some real clarity.